Number one thing everyone needs to do is to stay informed. Just write all the thoughts that you have in your head. And at your next appointment with your doctor, then you're going to ask those questions. You just want to know everything. The more information, the more power you have. And that helps you make a decision.
All right.
What motivates me is the fact that there is no cure. What motivates me is the fact that I still see myeloma impacting our community in ways that it shouldn't. And knowing that a lot of it comes down to lack of information and lack of access, and those are the things that need change. Everybody has a phone. Everyone has the ability to connect with other people that have information that can help them and build online communities and just figure out ways to really move past where we have been over the past few years in order to help find a cure for myeloma, because that's one of our biggest issues with African Americans not being involved. If we're not involved, we can't be a part of the solution. And so we really do have to start learning how to be more proactive, be more open to learning more, be more open to sharing. I think that's one of the things we really need to make sure that we change. We start to share more, connect more, communicate more in order to help make some real progress when it comes to cancer treatment and better outcomes.
All right. Good evening, everyone. Good evening. I know we can do better than that. It is so great to see you all tonight, and I want to thank you for coming out to our town hall on the political determinants of health. We have, yes, woo! And let me thank NMQF for being so bold, so courageous in helping us to have this conversation tonight and helping us to really explore those instigators of the root causes of health inequities in our society. I think it was LaShawn McKeever, Dr. McKeever, who says her heart is full after we saw each other tonight. And my heart is certainly full after seeing everyone. It feels like a family reunion. And again, I want to thank you all so very much for leading from the front, not the sidelines, on this really critical issue. You know, when people think about the political determinants of health, I'm sure many folks were thinking, what the heck is that about? I've heard of the social determinants of health, but what are the political determinants of health? So we're going to take a deeper dive, because what research has shown is that downstream interventions at the individual level are more likely to increase health inequalities than are upstream interventions, which focus on social change or policy change. So we're going to dig down a little bit deeper and understand how the social determinants of health, when we talk about redlining, when we talk about highways that increase asthma rates or type 2 diabetes, all of these things, we're going to explore them in greater detail tonight. So when you think about, for instance, obesity not being classified as a chronic disease despite thousands of peer-reviewed journal articles, right? That's a political determinant of health. Mm-hmm. When you think about organ transplants in our country, with kidney transplants, again, when we see that African Americans have higher rates of having their kidneys discarded, there's a political determinant that we've ignored. And the list goes on. So tonight, without further delay, let me get us into this topic and talk about the role that they play in creating these systemic health inequities that have yielded worse health outcomes for racial and ethnic minority communities. And I know that the theme of this year's conference has been focused on data-driven solutions. And tonight we want to delve a little bit deeper, because we understand on this panel that if there is no data, people say there is no problem, right? Data is a critical political determinant of health.
It is.
We're going to explore that tonight. So let me begin by introducing our distinguished panel. Tonight we have Reverend Siobhan Arline Bradley, who's the president and CEO of the National Council of Negro Women. Really excited to have you, Siobhan. We have, after Siobhan, Rochelle Garza, Commissioner Garza, who's the chair of the U.S. Commission on Civil Rights, followed by Beth Link, who's the executive director of When We All Vote. She's going to really get us to look on the front end of these issues of voting and advocacy. Joseph Sakrin follows. Dr. Sakrin, who is the Executive Vice Chair of Surgery at Johns Hopkins Medicine. He is not only a trauma surgeon, but he's also the victim of gun violence. We're going to explore that a little bit tonight. And then at the far end is Danielle Turnipseed. Danielle is the Chief Public Policy Officer for the Association of American Medical Colleges. So won't you join me, please, in welcoming our distinguished group. Thank you all so much. So I wanted to begin by level setting, and I actually wanted to have you all, if you could just briefly introduce yourselves more. Tell the crowd why you believe this conversation is so important and why you're so excited to talk about the political determinants from your vantage point. Starting with you, Siobhan.
Well, good evening. It is so good to be back in my family reunion. I used to come here all the time when I was at the NAACP, and just really re-energized as I start to think about the work of NCNW. We were founded in 1935 by Dr. Mary McLeod Bethune, and 22 Black women's organizations got together in 1935 to have two major conversations. One, the economic experiences of Black women in this country, and the political experiences of Black women in this country. And it is 89 years later, and I'm still having a conversation about economic issues for Black women in this country and social and political issues. I will say this, sitting at the helm of this organization behind those shoulders has gotten me really excited about the political determinants of health because of two reasons. One, my buddy wrote that amazing book. Amen, somebody. It's a read that you should all check out because what it does, it gives you context on what I think many of us in public health world have already known, that there's connections between social and political experiences of all communities. But here's the context that most everyday folks miss. This is not just data for us. Right. This is lived experience for many of us. And so when I walk in the room, I deal with political determinants of health when I wake up. I walk into the room and there's a massive assessment about my experience, where I live, what's my education, how much money do I make, what's the zip code, is it connected to a tax base or not? And then there's decisions that are made about your livelihood, if you will, based on those social constructs and now political constructs in our country. I'll close with this and we'll keep going. I'm gonna preach, I'm gonna get long, but listen. I live in Howard County, Maryland, which is a planned community. And many people, we called it Mayberry for a long time. And then 2020 happened. And then after the pandemic, the political strife of a very progressive community has now turned. And now the Black Student Achievement Program is no longer available to Black students. Now the Gifted and Talented Program has been cut in 3/4 because 60% of Black students actually qualified for it. And so Black mothers have come together and now have started a section of NCNW to come in and engage in the political context of why it is even a conversation about why children can have an opportunity to learn the same ways. So I'm excited because NCNW stands on the shoulders of Bethune. We're still the only Black-owned building on Pennsylvania Avenue. We still got a lot of work to do.
All right.
Hi, everyone. My name is Rochelle Garza. I'm the chair of the U.S. Commission on Civil Rights. I'm also the president of the Texas Civil Rights Project. As some of you can tell, I'm expecting a baby. I'm happy to be here because, as a mother, I also have a two-year-old daughter. I live on the border with Mexico. Our politics are constantly impacting our lives in ways that we don't really know how to unpack, but it's there. It's something that we're seeing every single day, whether it's voting rights, whether it's the militarization of the border that we see where I live. I think these are all conversations that are important. I think also voting rights is something that's critically important that we see happen in Texas and beyond. I often say this about being a Texan it's a tough place to be from because we are the test kitchen for the erosion of civil rights, but we're also the the place where the protection of civil rights can happen. And we have a number of cases that show that, Roe versus Wade, Obergefell, that brought marriage equality. There's a number of cases that come from the state of Texas, and I think that being from the state is both a blessing and a curse in a lot of ways. So I'm happy to be here to have this conversation about all of the issues and the importance of particularly voting and getting involved in politics. I also ran for Attorney General of Texas, while becoming a mother for the first time. And if you are not getting involved in policy making, if you are not putting yourself into these rooms where you have never been contemplated to be in, you are never going to actually change what happens to your life or to the lives of the people that matter around you. So I'm happy to be here, part of this conversation because of that.
Awesome. Thank you, Rochelle.
Hello, everyone. It is an honor to be sitting in front of you as the executive director of When We All Vote. I want to thank Brandon, thank our esteemed moderator today for this conversation, because it is so critically important in this space. When We All Vote was founded in 2018, so about 6 years ago, by Mrs. Obama, our forever First Lady, who, gotta throw that in there, who had the idea of an organization that is focused on engaging folks around voting, closing the race and age voting gap, and getting particularly young Black and brown people energized and excited about voting and our democracy, and doing that engagement, that planning, that organizing outside of political party in a nonpartisan way, outside of political candidate, in a way that really connects with the community-based nature of voting, the community-based nature of democracy, really at the heart and the root of it. And so for me, I am a relatively new executive director for When We All Vote. I came over about just under 2 months ago, and it really is feeling like coming home. And I say that because one of the things that I have done over the course of my career is really talking about issues and how making our voices heard and engaging and resonating around the issues and that why we vote matters. And health and wellness and those social determinants are so at the tip of the tongue. So most immediately, whether it was at the Department of Housing and Urban Development or at the Centers for Medicare and Medicaid Services, and I know just as the panel was starting, you were seeing that map of Medicaid expansion. That is a direct impact of who and those conversations that are happening with the folks that we are voting and electing in those spaces. Or previously in civil rights spaces, talking about how resourcing and making your voices heard and showing up and being present, whether it's in the 2020 census or otherwise, what does that mean in terms of how we engage? And so it is we'll talk a much more about the connection between voting and health, but it is really great to be here for this conversation.
Thank you, Beth.
Well, good evening. It's great to be here. I want to thank Daniel, Brandon, and all of you for the opportunity to be on this incredible panel. I feel like a little bit of an outsider because I bring a very different perspective. And as Daniel alluded to, I'm a survivor of gun violence. I'm a Palestinian American. My parents came to this country in search of those hopes and dreams that I think so many of us strive for. Mm-hmm. And I think what they never imagined was how our lives would be changed when at the age of 17, I went from being this healthy high school senior to collateral damage after I was shot in the throat with a .38 caliber bullet. And some of you can probably hear my raspy voice. I have a paralyzed vocal cord. I had some devastating injuries, but I also had the opportunity at this second chance.
Amen.
And, at 17, I think most of us, we have no idea what we want to do in life. We don't realize we're mortal. We don't realize the people that we have in our lives. And that moment, I look back at it, the worst moment of my life was also the most impactful because it inspired me to go into medicine. It inspired me to become a trauma surgeon. And at that moment, my whole and entire goal was to be able to give other people the same second chance that I was given. And what I realized as I was going down this path is that despite how good, one may think they are as a trauma surgeon, despite how incredible your trauma center or your healthcare system may be, if someone comes in that's shot in the head, there's very little that you can do to bring them back to baseline.
Wow.
And, we see this every day. One of our residents is Lawrence Brown, 40 under 40. Congrats, buddy, who's here tonight. We see this happening on a daily basis. And when Daniel, when you were asking us, well, why are you even here? Why are you excited to be here? I'm gonna just sum it up with one story and then we can talk more. I recently took care of this 16-year-old kid. And this kid came in, had a devastating traumatic brain injury. And I had to do what I consider is one of the worst parts of our job, as much as I love what I do, which is explain to a mother how her child that left that morning is never coming home again. And I go up to the ICU and, honestly, I try to do anything possible to avoid that moment because every time I do it, a piece of me dies. And I'm looking at this mom and I'm looking at her through this window and she's holding on to her son's hand, holding on to that last glimmer of hope. And as I walk in with the rest of the team, I began to explain this devastating injury. And as I began to explain this, she began telling me about her son, how he was the first in their family to graduate from high school, which in Baltimore in the Black community is a big deal. How he had hopes and dreams of going to college, none of which will ever come true. And as she did this, she looked up at the team and she saw how impacted we were as a healthcare group of practitioners that were taking care of her son. And she walked over and she did something I'll never forget. She put her hand on my shoulder and she said, "Are you okay?" I just want you to think about that for a second. Here's a mom that just lost her son and she's asking us if we're okay.
Right.
It's moments like that that restore my faith in humanity, and it's moments like that that get me to wake up every day to try to do everything possible to eliminate the inequities that we know exist, that frankly COVID just shined a light on,
That's right.
that have been disproportionately impacting, brown and Black communities, rural white communities, cities like Baltimore, and we have a responsibility to tell those stories. The last thing I'll say is that, the media has done, traditionally a job of telling the story about mass shootings, which of course are important and we want to end. But that's less than 2% of the public health problem that we face. And every day in cities like Baltimore, Philadelphia, Chicago, there are young brown and Black men that are being slaughtered on our streets. And we got to tell those stories. And so that's why I'm here today.
Thank you, Joe.
Wow. I thank you for your story. Good evening, everyone. My name is Danielle Turnipseed. I'm with the Association of American Medical Colleges, AAMC. I'm the Chief Public Policy Officer. I'm blessed to have, first of all, I'm blessed, full statement.
Yeah.
But I'm very blessed to have members of my team here that are seated right up front. Not like I told them to sit right here, but okay. Who do the work day in and day out, night and day. If you're working with me, a lot of nights. But also to be able to call Johns Hopkins as well as Meharry. And that is just 2 of the 158 medical schools in the country that I represent, that we represent in our association, our members. It is a privilege to represent you for the work that you do. It is an honor to work with Daniel. When Daniel calls you, you're like, oh, that's my name coming up on the, oh, that's Daniel Dawes, I gotta pick this up. Name coming through on the phone. And to know the kind of work that's going on at each and every one of our institutions, it gives me hope.
Yes.
It gives me hope. Because we are the incubators of the future physicians that will take care of you and your communities. We will do, like just described here, we'll stitch it back together, and to have patients that are so concerned about how you're faring as well, it really does warm my heart because they see you as a part of the solution, even in their lowest point.
Yeah.
So, you know, how does politics enter into medical school, right? The amount of debt that our students incur, $250,000, I heard it in the back. $250,000 at least, around that. The residency positions that you will assume are not equal to the number of graduates. So here you could complete medical school and not have a residency to go to.
Right.
Those residencies are funded 30% by Medicare, and there's the hook, because it's always a hook.
Yes.
Hearing about education in Howard County, what's the hook? We have Supreme Court decisions that are impacting how we can decide
Right.
for our profession who has not the highest grades,
That's right.
not the highest scores, but the highest potential. The highest potential to go through a process. You have to be qualified, but med school is going to do something to you, and when you emerge, you can assume one of these positions all across the country. But we want to pull back the starting point. We want the kids out of talented and gifted programs. We want to disenfranchise people from exercising their right to vote. We want to tell them, you should just concentrate on being a doctor. You don't need to get into politics.
Right.
Just keep doing the same thing every single day and not paying attention to the who, what, when, and how, and why it comes through the door. That's the reason why I decided not to be a doctor. I wanted to, instead of seeing the same patients coming through as a clinic that I toured, I said, how do you stop people from coming through the clinic door? And that's the heart of politics and policy, because there's so many people making what may seem like a small decision. Tax bases, funding your schools, curfews, who's profiled,
Right.
barriers that we're putting up around, borders. Another small thing, what is it? Women's health.
Baby.
We've got people telling us what we can do, and they aren't engaging the communities who are subject to the impact of their decisions. And then you have people up here from full spectrum that have to come here and try to undo and clean up and work around. So I applaud not just my colleagues here, but Brandon and his whole team at NMQF for making sure that we had this kind of conversation.
Exactly.
And again, it is an honor and a blessing to be here.
Thank you very much, Danielle. And I think you can see why I got really excited when we were putting the panel together, because I think, Joe, you might have mentioned that you felt like you were the outlier, but I think everyone here tonight brings a unique lens to this discussion, which is exciting. So I wanted to pivot now and talk about, when you think about the political determinants of health, right? Those factors that are driving these health inequities in our society. What's the first word that comes to mind? And I'm going to start with Danielle. Yeah. Sorry, Danielle.
Let me get a sip.
No sip, girl. No sip.
I think the political determinants really comes down to power. It's not experience, it's not knowledge, it's who holds the cards. And, there are plenty of people who are 100 members of the Senate, 435 members of the House, but your states, oh my goodness, where you live determines so much about your health, your future, your viability. I hail from the great state of New York. Very fortunate to have a Democratic governor and members of the New York delegation on a federal level who are quite in touch and in power. New York has the leader in Schumer and also the minority leader in Jeffries. So you best believe that New York is in the House, but New York is running plays and policies in coordination with a Democratic governor, and it makes sense. We're not at odds with each other for the most part, right? So I think the power is the first word. And when you think about power and how someone comes into power, you've got to consider it at the local level as well. I mean, you know, running for office is available to so many people, but when you think about the concentration, again, in New York, you're probably thinking about New York City. I lived on Long Island, right? But when it comes to the assembly, it's upstate, it's Western New York. You have no idea what the people who are exerting power over state policies have done, have seen, experienced. So we talk in New York, upstate and downstate. Well, downstate concentrated into a small area of New York City, but the impact of state policies is really made and is really felt from a much larger geography. So the concentration of power, and that's the same, you can pick any state, California, Florida. When it gets down to people in power, it is diffuse, and there are people making decisions for you in every state who you can't even tell me their name. You don't even know. They don't know you, and they're not taking the time always to get to know you. So power.
Thank you, Danielle. Power. So Joe, how about you? What's the first word?
Yeah, well, look, I think that was a great, summary. For me, it's more existence. And I know that maybe sounds dramatic, but the political, if you think about the social drivers of health, as Daniel, as you've written in your book, right, every one of those social drivers has some sort of policy behind it. And whether, like you're talking about, whether it's housing or education or food scarcity, and the list just goes on, right, they're all interconnected. And those components impact not just individuals' existence, but existence of populations, some of which are disproportionately impacted. And so that's really the first word I think that comes to mind.
Another powerful word. Thank you, Beth.
Yeah, I would say kind of similar and just kind of building off my panelists' thoughts is voice. And we talk a lot about, particularly in this election and this year, when asking the electorate or kind of Black and brown and young people, how are you feeling about this election? People are saying, I feel scared, I feel anxious, I feel frustrated, I feel angry. And that feeling transcends and obviously has impacts on people's desire to engage. But ultimately, it is about making your voice heard, not throwing your voice away, and ensuring that you understand that this is our moment when our democracy is saying, we want to hear from you. We want to hear your voice. We want to engage, and that is also so that is just such an important moment and piece of this pie. I also think that as what we've seen in some recent elections is that issues are really what motivate folks. Healthcare, there was already allusion and discussion around reproductive rights and abortion being on the ballot, and that is certainly something that we've seen time after time is something where folks are, I want to make my voice heard, I want to engage here, because they say, okay, when I make my voice heard, there is an immediate action and follow-up. And so on all of the experts here in the room, when you're having conversations in your community or with your patients or with folks who are coming through the doors of your hospitals or of your clinics or of your medical schools, having that conversation or connecting those dots of, we want to hear your story. We want to hear your voice. And here is a real moment and space where it is not just one day, it is not just 1 year, it is not just one election in particular. It's every single piece up and down the ballot. But your voice matters. We want to hear you. And that's what's important about this year. So I would say voice.
Thanks. Rochelle?
I think it's really hard to pick one word. I would say geography and time, because change takes a really long time. I think a lot about what has happened in Texas with access to reproductive health care services and to abortion care. And that's something that has happened over 40 years. It's taken a very long time to chip away at at access for a number of women across the state. And that started in the state houses. That started with electing officials in state houses, not just in Texas, but across the country in red states, passing laws that ultimately built up to where we're at. So it's a slow erosion of healthcare access that I think a lot of us came to rely on, and having that personal relationship with our doctor and that counsel and trying to understand and navigate pregnancy and motherhood and all of the issues around that. I'm also being from the border, I think that we're in such a weird intersection between federal law, state law, local law. When I was talking about militarization, a lot of people don't know this, but you can't leave the region. You can't leave South Texas unless you go through a checkpoint that's about 60 miles north. Or if you get on an airplane, you still have to go through Border Patrol checkpoints. So it has created an environment where you have a mix of people that are undocumented, people that are multi-generational or different generations, and that are experiencing challenges to even getting to a hospital or getting specialized care outside of the region. And you don't know any of that because the rhetoric is so different nationally. It's in chaos, and it's really in chaos because there are a lot of people down there that are really experiencing a lack of health care, a lack of opportunities, economic, social opportunities as well. And so that's why I think of geography too, because it's become normalized in these regions, and it's just been politicized in a way that meets a certain kind of rhetoric. So I don't know where that all takes us to, but I think overall it's about recognizing that over time we can change things. It's just people give up after one election.
Yes.
Yeah.
They're like,
Yes.
oh, things didn't change, so I'm going to go home. Yeah. And the thing is, the other side isn't going to go home. They're going to go back and they're going to collect. It takes years and years and years to build up to something. So if we want to have proper maternal health in Texas, it's going to take us 40 years. And we need to be fully committed to doing that. And it's going to take every single election from the local all the way to the national. So that's what I think.
I love that, Rochelle. You remind me of a saying that we have at the Meharry School of Global Health, that only policy can fix what policy broke initially. So thank you for that. Siobhan.
This one word assignment is terrible.
Okay, you could do two words too, like Rochelle.
So the first word that came to my mind was tsunami.
Ooh.
Because I think people do not understand what a wave does to land. When a wave comes over land, it begins to erode what's on the land, unless the land has stability. And one of the things that I find in this work is that social justice advocates have been hit so hard with so many different waves. And it has continued generation after generation after generation. And what I do see as we think about political determinants of health, and I think about the folks that are in this room, that's why I want two words. It's the wave, but it's also the accountability. Because we have to be accountable to every system that has not only been a part of causing some of these inequities, but accountable also into how we do our part to push back. I come from a people that, my family's from South Carolina. You know anything about Gullah folk, baby? So Gullah and Camden, New Jersey is a bad combination. But what it taught me is what I'm trying to get across to this room. There is no way that we can come from ancestors that can make it through a transatlantic slave trade. And it does something to me. Yeah. My son is 10 years old. And I know if I don't do it now, I want him to come home alive. I want him to be able to work in a workforce that sees him as a man and not a threat. And if I stop working, the wave will win. And so as industry, as public health folks, for all of you that are in this room, do not lose accountability in your heart and in your mind and in your work. Because this is what has happened. Elections have shown us that the lack of accountability has allowed people to come out of their holes and articulate what people have been thinking about for centuries. Yes. But it was not easy or allowed to be said because it was politically incorrect. Right. And now political incorrectness is no longer a thing. You can just say what you want to and still live. And so now, and you didn't have to clap, I knew it was right. You can not only live, you can actually thrive in your ignorance.
Disseminate it.
And so if we don't, as industry, as leaders in healthcare, decide, not today, we will not stand down on policies being passed. We will not allow the electorate to make a decision that is not only ill-informed, but it is informed by ignorance, racism, classism, and hate.
Yes.
And if we do not look at the healthcare workforce as the test case, let's be clear, on paper, I got an MPH, on paper, we're really good people. And then you get into the room and you find out what people think about you when you're in the room, or there are decisions that are made about a group of people, when there's no representation, when there's no one there to give you context about lived experience. That's why I'm saying it's a wave, it's accountability. Listen, Reconstruction was a real thing. Black men were voting in the 1800s.
Yes, that's right.
And then comes the hate and the ignorance and the fear that drives the way that people make decisions. Fear is driving what's happening in this country right now. And for us as educated individuals who come from various backgrounds, I charge you, if we want to honor what we call the American dream, well, the American dream was entrenched in diversity, equity, and inclusion. Now, our documents didn't align it in writing, but the forefathers' intentions were liberty and justice for all. And I love to come back to some of my colleagues and say, I thought you were a constitutionalist. Not the 3/5 part, because that's not working for me. But the intentions of what America said it wanted to be was that every person, regardless of hue, regardless of experience, should be able to come into a hospital room, into a clinic, and be seen as human first, and not as color only, experience only, thwarted by what you've seen on media. So it is accountability, it's wave, and it is our ability to say, if we can stand united, every industry, all of us have a part in this process. Movements were never won in a year or two. Yeah. That's why Emancipation Proclamation and Juneteenth is a real thing.
That's right.
Right? That's why Reconstruction into Jim Crow is a real thing. Women, that's why Title IX was a real thing. And now you look at what we're dealing with, we're literally rolling back the hands of time. That's why I keep seeing the wave. I'm saying push back on the wave.
Oh, I love that. You know, I'm really, really glad you used that analogy of a tsunami, because I think that's what it feels like to a lot of folks. Every conference that I go to, every time I get to meet with health equity champions, you know, I hear this refrain, the sense of apathy for many folks, right? Folks who are saying, I'm tired, I'm sick and tired of it, pessimistic. I don't know, Daniel, if we truly can achieve health equity in this country. And I say, whoa, that's really scary, that here we have some of the biggest and brightest leaders across the country who feel that way. And I think that analogy is justified. Now, I want to pivot to some hope, right? Because I do think there is hope. As I mentioned with policy, you know, it's interesting when you look back now, we have 7,000 peer-reviewed journal articles that are published each year, owing to what you all have been doing over the years. I remember when I joined NMQF in 2006, at that point, we only had 600 peer-reviewed journal articles directly looking at these disparities. And I thought, wow, that's amazing, we got 600. Now we're seeing 7,000 being published at least every single year, which is remarkable. So thank you all for that, right? And the reason why this really matters, as you know, is when you go back, and I'm glad you talked about these different laws, Siobhan, when we think about what research is showing right now, take the Voting Rights Act, take the Civil Rights Act. Let me start with Civil Rights Act. Nancy Krieger, Dr. Krieger at the Harvard T.H. Chan School of Public Health did a study published in 2006, and she found at that time, which was remarkable for all of us, right, in public health, that when you looked at Title VI of the Civil Rights Act alone, when she crunched the numbers from 1965 to 2002, she found that 38,600 Black infant deaths were prevented through those years. Isn't that remarkable? 38,600 Black infant deaths. They also just recently crunched a number on the Voting Rights Act. Yeah. And they looked at a few counties to see, how things were prior to the Supreme Court, right, trying to erode some of the protections there. And what they found was that from 1965 all the way up, there was a 20% reduction in Black infant deaths in these counties in the South, owing to the Voting Rights Act. These equity-focused policies absolutely matter. This is why we're having that discussion. This is why the fight that you all are having to ensure that we get these policies not only introduced and negotiated, but passed and enforced, they absolutely matter. So thank you for bringing that up. I do want to quickly go then, since we've been talking about voting, I talked about the Voting Rights Act, I want to turn to you, Beth, since this is an election year, and talk more about why voting is such a critical determinant of health. As I speak to communities, many of them never quite connect voting to their health outcomes or their lower life expectancies. Yes. And so I'd be curious as to how you've been working to educate folks on that angle.
Absolutely. And I think, one of the things we see, and there is an actual direct correlation to folks engaging and voting and participation levels when you look state by state and county by county to actual health outcomes, which is why the AMA has made voting a social determinant of health and that community engagement. We can see those direct correlations. We also know that, I spoke a little bit about how folks are feeling in this year, that anxiety, that frustration, that anger that we're seeing all across the country. And many of the folks in this room may be feeling fatigued or tired or anxious about this election. That has a direct mental health element. And I think, one of the things, and as we think about and go into Mental Health Awareness Month in May, we're having conversations right now about the best way to combat that feeling of helplessness, of powerlessness, of voicelessness in this moment is to seize your voice, is to seize your power, is to engage, make sure you are ready, registered, educated, and ready to mobilize those in your community to vote. That is the best thing that you can do in this moment. But when we think about that connection between participation, civic participation overall, and you can also look a little bit more broadly than voting itself, but also look at other ways that you can engage with our democracy and health outcomes, you also can connect that to the resources that are coming into your community. I talked about Medicaid expansion. You can look at how, particularly where we're seeing higher rates of participation, also correlates with some of the outcomes in some of the recent reproductive rights related ballot measures. And we are expecting that around 15 states in this upcoming election will have abortion or reproductive rights on the ballot. And we expect higher participation in those because we know the issues mobilize and engage people. We know that when folks are motivated and having active conversations around housing costs or ability to access prescription drugs or things in their community, they are that increases participation and then ultimately nets positive outcomes for the folks who may feel as the voiceless or otherwise disengaged previously. But we definitely see that connection. It is also very related. We were talking about education levels and investment and resourcing on that piece as well. The last thing I just want to say related to this is, I think as you framed this question, a piece of it is about having the knowledge that you need to seize your voice, to be ensure that you're registered, ensure that you're getting folks in your community out and ready and able to vote. We did with our partner at Circle at Tufts University some research about how do young people feel about voting, and we found that many young people feel that they do not feel qualified to vote because they don't have the information that they need. We saw in the Black community in particular, it is I do not know all the ins and outs, whether it was about the topics or the process. And that's why when we all vote, we really focus on making sure folks know their dates and deadlines, know the resourcing, and that's why that knowledge is such power. Yep. We're want to make sure, and I think that as folks in this room are thinking about how you can engage in helping share and connect folks to those resources, it is making sure that knowledge, that is not controversial, right? It is just sharing the knowledge, sharing the information about how folks can engage. We have resources for you that we can connect with you, and we really do appreciate the NMQF for joining our Culture of Democracy Collective, which we can talk more about. But it's really arming folks with the resources that you need to seize your power, seize your voice, and engage.
Can I add to that? Because I just, that was amazing, Beth. I want to also talk about voting from the context of our Supreme Court.
Yes.
Voting is the reason why Roe v. Wade is no longer. And I don't think that people have really connected and understand that. That's because they didn't have, Schoolhouse Rock, right? There's a massive loss of education in the space of folks understanding how their vote actually affects the way that a Supreme Court can make a decision. So now there are Supreme Court justices that have an actual moral, personal response to and belief in Roe v. Wade being, most of them are pro-life, quite frankly. And listen, I'm a preacher, so I'm in this space all the time with a lot of conservatives that have a hard time understanding this principle. And what I tell them is this is about voting. If you would have voted for a specific senator that was in alignment with your actual ideals, then your senator would have confirmed or not confirmed some of the people that are up there now. They did a great job with Ketanji Brown Jackson, by the way, but there's some others that I'm concerned about, solely because voting was an actual part of a larger issue, which was this symptom of moral compass legislating that has put people in a bind. And this is the preacher telling you, please stay out of my house. Please stay out of my business. And please let me do what I do. And I think that what we've not done as a collective, particularly and this is heavy in Black communities. Like, we have to understand that, particularly in Black faith communities, we are a much more conservative context for a lot of folks in Black faith spaces. And so when I connect voting to things like that, I said, I didn't even think about it that way. So I want to help you have some practical ways to help people understand voting is bigger than just the ballot box. It affects the way that we get our trash collected. It affects the way that your kids get access to things in school. So it's a larger framework that we need to talk about as we think about voting.
That's right. As Brett said, it's not just one
Danielle. Because along those lines, there are trusted messengers, just like the good doctor here, and realize that there are campaigns out there like Vote ER that provide resources, and I don't know, you're nodding like you're familiar. When people come to a doctor or come to a hospital, that is a perfect point, if you will, to just engage with someone. How are you doing today? We got some downtime to talk while we're waiting in the emergency room. Do you need to register to vote? Here it is. It's easy. You can sign up. You're not pressuring anybody on how to vote.
That's right.
But maybe you need to make the connection and say, I'm only getting 25% of the charges for these services that I'm delivering. Why? Because that's a Medicaid payment rate. Or I'm getting 40% at best because that's a Medicare payment rate versus a commercial rate around insurance, et cetera. So why does the hospital have to close? Because we don't have funding. Where do we get our funding? Not from you. You came in, you need our services. There's a whole bigger system that's impacting what you get. And I have to make mention as well that we at the AAMC, through the work of my colleagues Erica and led by Clarence, put together a physician in training toolkit around advocacy that some would like for us to not share with physicians how to advocate.
Come on.
So all you're supposed to do, and when I see these arguments, I just hear LeBron with shut up and dribble. I'm like, shut up and
That's
surgeon
exactly
or
right.
something.
Right.
But
It's
people don't
true.
want you to do any more
That's
than
true.
what they think you should be doing. So I have a ceiling or a limit for you. And what it is for you to be a doctor or a dentist or a nurse. I don't intend for you to talk to the people you serve. I don't intend for you to leverage the trust. If I had something going on and went to GW right now, that doctor could have full range over me, and guess what? I trust her or I trust him vis-a-vis their training, vis-a-vis their credential.
Right.
So who else is going to talk to you about voting? Won't be my mechanic. He takes me every time I go in there, right?
Yeah. If I can just
Thank
build
you.
on that for a
Yes, Joe,
second.
I see you
because
itching to respond.
First of all, I think that's a great example. Vote ER is a terrific example of how healthcare professionals have engaged in this space. And I think this goes back to Beth. I feel like you're weaving in just such a powerful narrative around the power of our voice. And when you look at, why our voter turnout rate is so low in this country, part of the reason is that people in and of themselves don't feel like they can make a difference. Oh, it's not going to
true.
matter. Imagine if every one of us thought differently, right? I chair the Brady campaign, which is the oldest gun violence prevention organization started by Sarah and Jim Brady. A lot of you know, right, Jim Brady was shot during Ronald Reagan's assassination attempt. And Sarah Brady used to say, if you can't change the law, change the lawmaker. That goes back to the accountability
That's
piece,
right.
right? Because
Yeah.
we have to hold these individuals accountable, right? To all of these inequities that we are seeing in our cities and our states across this country. Most governing happens at the local and state level. We're always focused on what's happening at the federal level. But most of the stuff is happening in our own backyard, in our own communities. And hopefully we're gonna have time to talk about this. But the advocacy piece that you bring up is so critical because, frankly, healthcare professionals have been afraid to even touch that topic. They view advocacy as a dirty word. I always tell them, listen, policy is not the same thing as politics. And I'm not opposed to being involved in both. We are part of the social fabric of communities.
That's right.
And like you said, think about how the social issues that we're talking about today, whether it's gun violence or COVID or racism or immigration or climate change, are interconnected to health. And that trust and that community piece is so important. And we have this ability, I think, to leverage that in a way that could be impactful.
Amen. Thank you, Joe. So I know we want to open it up to questions from the audience. So if you can start thinking about any questions you might have for our panelists. I'm going to ask one final question. I have a whole bunch, as you know, but let me go to this one really quickly while folks are thinking. And there are 2 microphones in the room, one on each side. So if you want to start lining up, if you have questions, please, that would be helpful. So last question for you all is, what political determinants of health metrics can be used to track progress toward health equity? And Rochelle, why don't we start with you? What political determinants of health metrics?
Metrics.
Yeah, metrics can be used to track progress toward health equity.
I mean, I want to lean into this representation conversation about who's representing us in politics. Just looking at the state of Texas, we're 60% people of color, 40% are Latino. And when I ran in 2022, I was the only woman of color on the statewide ticket on the executive side.
Wow.
I was the first Latina to be nominated to run for Attorney General of Texas by any major party. And it was 2022. I'm also somebody who my grandmother was a farm worker. She had 13 kids at home. And I know the challenges. I came to that role and that run understanding the challenges that were happening at the state level. Understanding that there was a shortage of formula for infants. at that time, understanding that there are a lot of people struggling and our governor would not expand Medicaid. We had a historic surplus of over $30 billion, and none of that went to public education, none of that went to like stopping areas from flooding or even getting some cities some access to sewage and drainage. So, you know, I think representation is critical here. And for me, a metric would be to see more people that understand the experience, that are reflective of the population running for office, but being supported to run for office, because that's the bigger piece here. I mean, it is challenging to raise money as a person of color who's running for office, who doesn't come from a lot of means. And I think there needs to be systems of support to encourage people that look like those they want to represent to get into these offices. So that would be something that would really be a game changer for me to see.
So representation.
Representation.
All right, Beth.
Yeah, I want to share kind of 2 quantitative metrics and then 2 more qualitative metrics. So on the quantitative metrics, number of registrations. When we talk about registering people to vote, it is expanding the electorate, right? It is expanding who has an opportunity to make their voice heard. And that can be a daunting process, but that is a very hard number that we can look at. Like, who is voting for the first time? One note we know, 16 million young people are turning 18 or will have turned 18, and this presidential election will be their first major election. And so that is a very ripe audience. But even beyond that, there are a number of folks who are ripe to be engaged or re-engaged. They may have moved, they may have gotten busy. Check your voter registration status, registering. That's a really hard number. Mobilizing folks in terms of actually getting folks to vote early, to engage. We run a program called Parties at the Polls, which is designed to make voting fun, and we are going to be hosting parties around early voting locations in 15 focus states, and would love to partner with folks, to get folks engaged, excited, energized. We bring music, we bring fun, and there's all of that. On the qualitative side, I would say 2 things. One is culture. So the culture around voting, it doesn't feel great right now. It feels stressful, it feels scary. We lean on our celebrity, influencer co-chairs and ambassadors, as well as major cultural moments, to find and inject the fun back into voting and inject that energy. But overall, we're looking at how can we shift that culture so it doesn't feel like taking your medicine or something painful, and that it is connected to your why. So when we talk about having those conversations in the office, if folks are asking, well, why isn't more of this covered by my insurance? Or why can't I access this resource? It's like, well, actually, here's how that works. And are you registered to vote? Here is a way, right? Like, let's connect some of those dots for folks, because we know that works as well. And then the last thing I would just say, and you all are much more positioned to measure this, is wellness. I think that everyone is just, mental health is so top of mind all across the board, but everyone is feeling it in this moment. Movement leaders are tired. Many of you are probably tired, but we can't afford to be. We've got to keep going. So I'd love to have more conversation about how we measure wellness at the end of this.
Thank you.
I would love to have Daniel, in my world, after you buy your ticket for Ticketmaster to either Beyonce or Taylor Swift, before you go to that concert, you have to be registered to get it.
And we're working on that.
But on a more practical level, if you were to consider areas in a state that on average have low income or low educational attainment on average, and look at the voter turnout, the participation in the elections, I wish there was a way to set a metric, set a bar for the state to pump resources in, to find the people where they are, and from one election to the next, drive the people who you're trying to reach and who you're trying to help, drive them to the polls. Because what Beth said and what we talked about, people are tired. And if the people who are on Medicaid were to tell me, you know what, I'm okay, stop fighting for me. The people who are in the public school systems to say, you know what, I voted and I really voted again, I'm good. But we're assuming and we're acting on best intentions for individuals. And I really would love to find a way to draw more of those people out and hear their preferences. And I think looking at areas that are low income and low turnout, or low education and low turnout, should be something that's on the list for every state to do. Raise the bar a bit.
Yes, raise the bar.
Daniel, if
well,
I-
well, let me.
okay.
I just want to go to our audience right now because I see folks lining up. So why don't we start on my left, Dr.
Sure. Hey, Daniel. Hey, friends. How y'all doing? So I'm Dr. Joya Kriya-Perry, OBGYN by training, the founder and president of the National Birth Equity Collaborative. And this is really a question for my dear friend Siobhan, because she keeps me accountable. I love you when you use the word accountable. But anybody else can answer too. So about 3 years ago, you and I were shopping an idea for a White House Office of Sexual and Reproductive Health and Well-Being. And we were really close. We met with advocacy groups, we met with large institutions, and you would warn me that the word sex is where people would get stuck. And I would say, but I'm an OBGYN, your body parts are just for reproduction. I'm not here to just create workers for capitalism. I actually want pleasure, and we can talk about gender. Do you think we're any closer to having a conversation about sex, considering what's been going on with the overturning of Roe and the lack of bodily autonomy in this country? I mean, I'm sure Beth might have some ideas about that too. But the word sex, can we use that in government, please?
Yeah, I don't think we're anywhere near it. I mean, we just got to be honest about it, and especially in this election season, when you're watching a consistent tidal wave and tsunami of moral consciousness that is being integrated and penetrating in government exchanges. And let me be honest, like the whole sex discussion for most folks in government is connected to two places: education and how money is spent. And
Exactly.
and I think for us on the public health side, we're like, of course it's education. And of course we want to spend money there where there's a massive amount of electorate that's like, stay away from my kids, stay away from this conversation. And so how do you balance that? I think a lot of it is how we message it, right? And I think that understanding what audiences can actually absorb that is one thing. I remember that time, 3 years ago, think about where we were 3 years ago. First of all, just came off of the first wave of the pandemic. Folks were starting to get shots in arms, and we thought we had it. We thought we had it.
We thought we had it, baby.
And we don't. And I think now more than ever, it's going the opposite direction.
It is.
So I think as we look, but what message is working
Okay.
is personal freedom. So personal freedom for me is defined as so many different things.
Right.
Because sex can sure enough be up in personal freedom. But in the context of healthcare, I'm not even use the word abortion much anymore. Like I'm really helping people understand the ability to have government overreach is a problem for me, and having personal freedoms and political freedoms. And those messages have actually resonated with not only progressive, but also conservative audiences, because in context, people understand my ability to have a choice about something. It's just when you put it in the context of reproduction and women having a baby, choice is like, oh, that's not the word you could use. Okay, but I want the choice to do what I want to do. I want the choice to be able to vote who I want to vote for. They're like, that's the choice I want.
Okay.
So it's just understanding the audience, understanding where we are politically. And yeah, sex is probably not going to be the word we use in 2024.
Thank you.
Thank you, Siobhan.
Love you, girl.
All right, why don't we turn over here then to you, sir?
Howdy, my name is Luis Ceja. I'm an internist pediatrician and health services researcher at the University of Pennsylvania and the Children's Hospital of Philadelphia. My question relates to how we continue to politicize blackness, communities of color, and public health. It was recently reported the president is deferring action on menthol-flavored cigarette ban in anticipation of the upcoming national election, despite the overwhelming amount of evidence demonstrating its efficacy and health benefits for individuals and the general public. Which brings me back to Danielle's comment about power and the white supremacy principle of right to comfort that contribute to the political determinants of health. What is the role of academic medicine, organized medicine, community-based organizations in dismantling these systems of power and oppression that shape the reality of our health inequities today, looking beyond data collection and reporting? We've heard enough about that.
Oh my gosh, and they have like
You gotta
5
slow down
minutes.
that last part.
Yeah.
5 minutes to answer this one.
Hold on now. Say that last part of your question so we can understand what you said.
Sure. What is
Don't
the
do
role?
the whole thing. Go right in half, though.
What is the role of academic medicine, organized medicine, community-based organizations in dismantling the systems of power and oppression that contribute to our health realities today?
Yes.
I did not hear that question.
So, you know, Luis sent me a message. Hey, saw your name on the program. See you. Yeah, see you. XOXO. You should have texted me the question in advance instead of like, hey, look who's yeah, so I got your number, literally.
Great question.
You know, you're spot on, and let me say I'm proud of you. I saw you last year here, and glad that you're at UPenn doing what you're doing in OBGYN, I believe. We can't sit on the sidelines, and that's why through my association and my department around government relations and advocacy, we're meeting with every single door. Anybody that will have us and even those that won't. And our message is consistent, it's salient, it has to be clear. And what I would say is we can't allow people to redefine our narrative. You can't tell me what a DEI office does and label it as destructive when we have people that do this work. You can't come and bring in critical race theory or a lot of the other things that are going on in the world today and try to make something that is supportive and positive and impactful into your narrative of destruction and disempowering. So, you know, as a lawyer, I'm a lawyer, other people are lawyers, I know it's a room full of doctors, but we're taught, you know, very early in orientation about the zealous representation of our clients. I wish that the same kind of approach was instilled about the zealous medical care and treatment of your client from a whole person perspective. If that were the case, then we would have hard decisions, have hard conversations. We wouldn't send somebody who comes in as a victim of domestic abuse, just patch them up and send them right out. We would say there's a place for you to go. We wouldn't have people who were dealing with opioid crisis say, hey, here's a Narcan shot. We would say, where are you getting this stuff from? You don't need to be doing that. Let me help you find another way. So I don't think that we can avoid as academic medicine. We're not as an association. But I'll tell you this. The N for institutions is 158. And part of what I think is that in order for someone to really stick themselves out at the top of wherever they might be, nobody wants to argue and advocate for a notion. I need to advocate for the reality, which is I have 10, 100, 50 qualified minority students who want to be doctors. I don't want to just advocate for the notion of diversity. They got to be there. Because nobody is willing to go head to head with a governor, head to head with a senator, or whoever else on a notion, on an ideal. So we've got to make sure that people are actually ready and craving for the positions in medical school. They're craving the benefits that we're advocating for, the educational opportunities that we say should be in our school districts. So I think that it is our place to get involved. How we get involved, we're not telling people what to do. Let me know the last time that worked, telling people what to do. Right. But we've got to let them. What we're doing is we're letting people know their power who are coming to you at a vulnerable moment, perhaps, and we're saying, go find your power. And to the extent that our institutions can help them tap into that, that's exactly what I think we should be able to do.
I got more to say, but we're going to talk after.
Yeah, so I promised Joe 30 seconds,
just
quick,
one
so we can get
quick
to it.
minute. I think your question is spot on. There's a generational gap that exists. When you think within academic medicine, you look at healthcare professionals, people like yourself, the next generation of healthcare leaders in America, they are interested in figuring out how can I be impactful beyond the bedside, right? The problem is that they're not empowered necessarily with the knowledge and skills to be able to take that data and science and to translate it into messages that resonate, which is why at Hopkins, we're working on a curriculum that helps integrate that at the level of our medical students, our faculty, and across the board. I'm not saying everyone has to do it, but this notion where our entire role is simply to take care of patients, that's important, and I'm a very busy clinician, but there's a lot of us out there that understand our interconnection to community, and being able to help us translate those messages in a way that's non-judgmental, that's objective, is incredibly powerful. And we can talk more after.
Thank you, Joe.
Thank you all.
All right, so next question, please.
Hi, good evening. That really lends well to my question, actually. I'm Dr. Toya Kelly. I'm a family medicine physician and active duty with the United States Public Health Service. Thank you. I'm proud to serve. With that serving, though, you know, especially during COVID and other things, we were constantly deployed as officers. And when we talk about reproductive health and where we're generally stationed in very rural or underserved, unserved areas, it is difficult for our officers. And I would love to hear the panel's opinion or suggestions on how to best teach and educate a curriculum, in other words. It doesn't have to be just for officers, but in general, for students, for residents, just a curriculum, best practices that you've learned to implement. You talked about how you're teaching your staff and things of that nature. What would you put in place that would be helpful to teach people how to advocate for their needs and push the issue over the finish line, right?
So you stand right there, and Clarence, you stand up. Right there. The answer is closer than you think. Clarence is the lead author of a toolkit that we have that talks about advocating in so many ways, and everybody else can go see him after throughout the conference. But you know, these are actual real problems, and people don't think about the consequences when you have not just one state, but even the decisions will say, oh, you should be able to just go someplace else, not our state. Well, if you look at the map, it's sweeping. And if it takes, more than a certain amount of time, a few hours, or you have to take a plane, or even if you go from Indiana to Ohio, you have to worry about a physician being targeted for, performing services that are legal in one state versus another. So, we have ways for people to advocate, and when it comes to curriculum, we like for curriculum to be left in the hands of the professionals that are left to training and recognize the need to teach about certain things. And it sounds like there's a need to teach about this for, certainly for the military or the ones on active duty. I would say speak to people who are involved in curriculum overall or involved in putting out information overall, and then help package together what kind of information should be given to women and men who are out and deployed so that they know before they have a crisis what to do.
Thank you. Rochelle, I know you had one.
Yeah.
I just wanted to jump in here because I think this is important. This lends itself to advocacy. I feel like physicians at this moment in time have an opportunity to be much stronger advocates in our state houses and with representatives. At the Texas Civil Rights Project, we follow what happens at our Texas legislature. They only meet every 2 years, and it's very intense. It can last a couple months or it can last 6 months. And I think showing up and talking to legislators when you're seeing what's happening in the state houses and really pushing the envelope on that front is really critically important, because your voices you're really telling us what you're seeing. I think for the vast majority of people, especially when, Texas had the 6-week abortion ban and we experienced the fall of Roe before it actually fell, people didn't really understand. But I met with physicians and they told me what their patients were actually experiencing. And I think that if the rest of the country, the rest of the state had heard, 2 years ago what was actually happening, we would have changed our minds sooner, right? So you all hold a lot of power, and I would encourage you to exercise that and really push.
Thank you,
But
Rochelle.
just for practically, because I used to be an OSG, they can't do some of that. And I think I want to make sure we talk about your practical question. because some of the challenges that they have is when you're in uniform. USPHS is under the Office of the Surgeon General.
Well,
And so I think for your context, though, it's not just about curriculum development. You're looking for strategies on the ground. How do you show up, not just with content, but also strategies on how? I think we're out of time. I see 27 seconds, but let's talk about it offline. I saw you laughing. I was like, wait, let's talk about what that actually means on the ground, because in partnership with the medical colleges, that's one piece. But for officers in that moment, there's some other accountability pieces that they have that are not clear. Shout out to Vivek Murthy, who's our current Surgeon General. I was in his office. We were in the Obama administration, so I got you. I'm gonna call you with a list of things. I know what you were asking. I got you.
And I have some ideas for you as well. I'd like to talk to you.
I know where you were going.
Absolutely. So
And
let's
then
go.
one thing-
Can we just?
Yeah.
I'm sorry, because I want to
I know,
get the last three.
They're blinking on
Yes.
this.
Thank you. Thank you very much. My name is Chinonso Akano. I'm a principal medical scientist with Gilead Sciences. And my question is coming from this book. If you haven't got this book yet, y'all should get it. You know, it's a very, very important book. Now, in chapter 6 of this book,
Yes, chapter 6.
now we're talking about voting as a political determinant of health. Now, just listen, just give me 1 minute. On Tuesday, November 8, 2016, the world waved with a great anticipation to see who would become the 45th president of the United States. The choices were Hillary Clinton, the lawyer, former First Lady, a career politician, and Donald Trump, the billionaire real estate mogul with no political experience. Now, Democrats had expected huge wins. I'm going to skip and go back to what we now see today, right? Data would now later show a significant decline in African American and Hispanic turnout. Two groups that stood to lose if the Obama-era health law was successfully repealed or undermined. I bring this to you all today, and my question is to you, Beth and Siobhan. Today, we have the data, right? Then what? Now what? What do we do with that data, especially with our young folks? Thank you.
Great question. So glad you read chapter 6. I read it too. So 2 things. NCNW right now is focusing on the Tufts data, actually. We're actually running our whole campaign on it. Our goal is to raise voting for 17 to 24-year-olds to increase it to 5 more percent. If we can get up to from 18 to 23% of them, our goal is now to go in every high school we have a chapter in this country to register high school seniors and college freshmen. Our plan is to not only increase that electorate, but also we have an 8-state strategy, it's very specific. Low propensity zip codes. What does that mean? That data that we're talking about is driven by where do Black and brown people reside and why did they not vote in either 16, 18, 20, and 22. That data is actually informing us. That's why we chose 8 states, because we realized that low propensity voters operationalize their communities in certain parts of these states. So I'm not gonna just do Georgia, I'm gonna do Athens and Atlanta and Macon and Columbus, right? I'm not gonna just do Michigan, I'm going to the D, right? I'm going to Detroit. And it's very intentional. Here's the last thing I wanna offer too. Do not miss out on voter suppression tactics.
Right.
Do not miss this. There's an intentional plan. That's why they won't let you give anybody water in a line.
Right.
That is the political determinants of health. And so what we're saying is that we're trying to activate not only community-based organizations, but partner with doctors to get in lines with people over 237 feet, was what the conference says on the paper. 245 feet, we're gonna have people set up with what they need in lines. Why? Because Black and brown people have high propensity of voting in early turnout. Well, that's why they're trying to decrease those dates. Souls to the polls. Sunday voting is a real thing for our people. And so these types of practical things we're trying to enact. And we actually are announcing June 1st, all of our 8 states and our zip codes.
Wonderful. Thank you.
And she's speaking of strategy. Siobhan is talking strategy. Beth is talking strategy. I'm not encouraging, we need to move away from the just pure debate and go into a closed room and strategize for an hour, strategize for 2 hours.
That's how we got there.
Yeah, and the thing that I'll add before Beth goes is instead of always trying to figure out how to convert someone with the way they think to your side or from one party to another. Leave them where they are. You draw out your people. Because we know with the data that if we had increased turnout, instead of converting, well, my mom was a Republican, my dad was a Republican, my grandma was, I'm not here to change people who think that they have to follow in the footsteps. I'm trying to draw people out who are already registered but not participating. There's actual data that for people that stayed home, that's why Michigan is so important. That's why Ohio, I mean, you can go through they have the states. You have to draw out the people who are already on your side, but don't think that they have anything at stake. That's what we're all up here talking about.
That's right. Beth, quickly.
Absolutely. And so I think it is important to just kind of pause, and Siobhan teed this up really nicely on why do folks not vote? One, it is real or perceived barriers to voting. So that means not being able to take time off, not being able to have your, someone see after my kids, or knowing there's going to be really long lines at the polling place and I live in Georgia and I can't get water because I'm standing in line. So real or perceived barriers to voting. Number two is a thinking around my voice doesn't have power. If I vote, it doesn't matter anyway. Nothing's going to happen. You all can really meet in that moment, and as you're having those real conversations, that's where it matters, where you're listening to folks and saying, oh, I hear what you're saying. You're not going to tell people how to vote, but you're saying, oh, you're seeing how less expensive your insulin is right now. Where those kinds of conversations happen is just making sure you also registered to vote. Let's make sure that you're, and that's going through your regular flow. And then the last kind of reason folks don't vote is not feeling like they have the information that they need, and that's a place that we can fill the gap. So a couple of things specifically that we can do. We've got a table in the lobby, and we're really excited that NMQF has joined what we're calling our Culture of Democracy Collective. This is a coalition of businesses, sports teams, media organizations, partners, hospitals, and community-based organizations at the national and local level that are committed to registering, mobilizing, and educating people around the vote this year. This is not controversial, and the woman who was asking about, as a representative of the government, I'm a little bit more constrained. How do I have those conversations? You can invite people to register. Vote.gov has been added to healthcare.gov. Something when I was at CMS was a conversation we were having a lot about how to add that into the portal, and it's up there, right? It is in those spaces, so you all should feel comfortable knowing that including that in and having conversations about how do we make sure in the conversation flow that's fed in. And we have message tested research, educational materials, hub materials that you can repost, as well as an actual technical portal to register people if you don't have that technical capability. We have that. Just see us in the lobby.
Thank you, Beth.
Thank you.
So Brandon was kind. He gave me 5 minutes. All right. So we can get our last two questions in. So I'm going to ask us to please be precise and concise. Yes, ma'am.
Hi, Dr. Jones Burton. I'm the founder and president of an organization called Women of Color in Pharma. My question to Danielle, we put out a statement vehemently opposing the anti-DEI in medicine bill or the proposal. My question is, what else can we do, or do you have an update on that? What's the association doing?
Yes, well, that's not a 5-minute question.
Well, we only have 2 minutes.
I'm glad to talk to you. I will say that we oppose the Educate Act, and to the point about strategy, glad to talk. My team is here. We're working a stealth ground game. We are meeting with people. We're talking with people. Tune in tomorrow. We have a day of action around diversity and strengthening the healthcare workforce. But when you're dealing with people that just oppose DEI, threaten to strip federal funding from institutions that have a DEI office, a lot of them are already dug in before they know what is actually going on. And that's this culture and identity politics. So we don't always take the bait, right? We're good. But we are actually talking to members in charge. We're talking to leadership. We're talking to offices that keep an eye to the ground, and that's R&D. We aren't just sticking with the Democrats on this. We take it seriously, but we don't want to overplay a hand because we recognize that this is largely messaging. It's a political year. Everybody's running, and some people are going to run on division, right? And not on diversity.
And not just healthcare folks too. Local advocates are actually backing that. We just did it for NCNW's Purple Days on the Hill, and that was actually one of the bills we looked at. So go look at healthcare, but also other
And
organizations.
Siobhan knows on this, one of the emails that I sent was to her. And we sync up because we were running into each other. She was leaving the
Capitol
Hill. I was going in, and we did the like, okay, girl, I'll catch up with you. I got you. I got my boss here. I'll check you later. But we need allies, not just in medicine, civil rights, education, freedom of speech. I mean, that's the kind of coalition that we're building, but it won't be televised.
That's right. Thank you, Danielle. Thank you for that
Great
question. So the last question for the evening.
Thank you, Dr. Christopher Irvin from Morehouse School of Medicine. Very quick, particularly since we've been talking about DEI and before that critical race theory, and to paraphrase the phrase, we need to be less concerned about the words of our enemies, but the silence of our friends. And we've been talking about DEI. Where are we with our so-called allies? Oftentimes have big D, little d, progressive, left of center, left wing. Whenever anything happens with the black and browns, they go silent. How do we address that? Because it's easy for the obvious, those who scream anti-woke, but then how do we deal with the silence, the shuddering, the quivering of those who could best help deal with the advocacy, but they shrink from the backlash?
Great question.
I want to jump.
Yes,
Listen, because I'm sick of the quiet. Dr. King said that in his letter in the Birmingham jail around the silence of those that are watching this happen. He was talking to other faith leaders, white faith leaders. And I tell my white colleagues often, if you don't know what to say, ask me, I'm gonna help you. Right? You have folks that you work with, your colleagues that you work with, there's an opportunity to inform messaging. A lot of it is fear. I'm clear on this now because I've had folks tell me, I don't even know what to say. I'm afraid to say the wrong thing. And we're in such a massive cancel culture moment that people feel like if they say something, they're gonna be, castigated. And I'm saying, well, join the 400 years, we're good. We're 400 years into this. So let me help you understand why we're saying you have to say something. There's no movement in this country that's ever worked with just one group of people.
Yes.
The reason why we have rights to vote, reason why we have civil rights is because there was an actual coalition of difference. Hence DEI. That's really what this is about. How difference comes together and unites around human activity in this country, which we call democracy. And so silence means you are complicit. That's what I tell my colleagues. Do you want this to happen? No. Well, let me help you help me so that we can change this for our children, for our future. Yeah. So that's number one, giving them the message. But here's number two. I also believe in calling people out. I'm very unafraid of saying, these are the companies and corporations that have supported us, that have actually kept their DEI office intact, that have been in alignment with us. And these are the jokers that were scared. We're so afraid of truth. And so I'm actually brokering something right now with the administration to say, listen, we're gonna have to help corporations get out in the world because you know what's happening? Whoever's the loudest squeaky wheel gets all of the play. Yeah. And so, this is not just about Democrats and Republicans, this is about just people in difference in this country. The louder you are, and when you say stuff loud and wrong, people believe loud and wrong all the time. Yeah. I've got colleagues that are conservative that are like, Siobhan, I don't even believe in that, but they just said we gotta say it. And it's really a reality. And so I think that, and this is a perfect room to have this conversation. My brothers and sisters of every hue in this room, we are all responsible. And if you're quiet, you're complicit, and you agree with what they're saying. And if that's not your answer, let's help you, because I don't want you to lose your job, but I want you to call out the job so we can give you an opportunity to create new space. Because some of this is about, you might be in the wrong place then. You know, I'm a civil rights leader, I get to fight every day. Yeah. And I love every ounce of it because I know I'm making lives better because I'm telling truth. And now I gotta walk with armed security, I don't mind, come see me. But let me tell you this, I will do it until the day I die because somebody did it for me.
That's right.
Absolutely.
Did anybody want to get one last additional response? Anybody? Good?
I would offer, you're a member and you're in groups for a reason, not just in February, not just in Women's History Month. So, if you're supportive of DEI and diversity, et cetera, it needs to permeate and be demonstrated. And if associations and organizations don't meet you where you think they should be, you have a choice and you also have a voice. So do you keep your membership or do you cancel it? But tell them why you're canceling.
That's right.
Don't just tell it and go away so their numbers are shrinking. Let it be just as known, right? And try to have that conversation one-on-one. And if they don't hear you and you get the canned response, you can always elevate. Because let me tell you something, other people do it all the time. Right. I mean, I've worked at other associations and people would be to the board chair, to the immediate past chair. And then you've got folks who are standing on truth and standing on what's right who are like, I see him over there, but should I speak? Yeah, you can speak.
Say something.
They're your representative as well, even in these associations. So don't shrink and ask them where they stand. Ask them where their statement is. Ask them to make a statement, and when they say, no, that's our boy, or no, we don't really have a problem with them, this is just one piece. Well, tell them it's a piece that's important to you and mobilize other people. Let them know about where the association stands.
Thank you, Danielle. So I wanted to just, as many of you know, I'm a scholar of history. And as I think about, the period that we are in today, it's a remarkable period. I believe that we are in the fourth period of a great awakening around health equity. It may not feel like it, right? Because we know that the forces of ill will have continued, as you mentioned with the tsunami, right? Continue to push back on opportunities and gains that we have made over the centuries. When you think about the first period of awakening in terms of health policy, this was under the Lincoln administration, right? Where they fought for the newly freed people and poor whites who were displaced as a result of the Civil War to gain access to what we call the social determinants of health. That was the Freedmen's Bureau, the first most comprehensive health policy developed to address the needs of very different people. Then there was a retrenchment period. It lasted almost 100 years in this country. Gets us into the civil rights movement in the 1950s. And during that time, 2 years into that movement, were health equity champions like yourself saying, Dr. King is right? Of all the forms of inequality, injustice in healthcare is the most shocking and inhuman. And so they went about mobilizing, and through the NMA, NDA, and others, fought to make sure that we would desegregate our healthcare system, right? They were addressing those overt forms of discrimination. Then there's a retrenchment that happens again to try to undo some of those gains. That's right. That led, of course, to the Civil Rights Bill, the Civil Rights Act, the Voting Rights Act, the Fair Housing Act. And then there was another opportunity, another awakening that opened up folks' eyes. And they said, wait a second, we address these overt forms of discrimination, but yet we still see these disparities in health status and in healthcare. What is going on? And so there was, again, another attempt by leaders starting in the 1970s to address those more subtle forms of discrimination. Well, there's another retrenchment period, and it hurts. But now we are today in a period where I feel so fortunate to be alive. Because when I think about how we all have governments at local, state, and even at the federal level who are committed to addressing not those downstream issues, not just merely nibbling around the edges of inequities. We have governments now, we have advocates who want to go further upstream to the political determinants of health. And it's so remarkable that we also have governments that want to center health equity to a degree that we never appreciated. I think, based on all that I heard today from you all, right, I'm inspired. You gave me hope to continue to even move that needle further than we've been able to. Amen. So won't you join me, please, in celebrating our distinguished. Thank you all very much. Thank you. Thank you. Thank you all.
Good to meet you.
All right, with that, I was told to let you all know that there is a reception on the roof following our panel, so we want to urge you to please continue the conversation on the roof. Thanks, everyone.
I guess you wonder where I've been. I searched to find the love within. I came back to let you know. Got a thing for you, and I can't let go. My friends wonder what is wrong with me. Well, I'm in a daze from your love.